Hey everybody, welcome to ChangeWorks Interactive. I've got a great guest today that I'm going to share some stories, and I'm sure he'll share some stories with our listeners as well. Dr. John Denby has been in practice for over 50 years. He's retired now. I could honestly say that every time I speak with John, it's always a lot of fun. We always have a good time. We always have a lot of laughs. One of those good times that we were just kind of reminiscing about a little bit is I met John probably 25 years ago, and when I met John, I knew he was a bit of a joker right away. My wife Rosemary worked with John for many years. And she would always say, I love listening to Denby because Denby's whistling in the hallway, and he always has time for his patients. Yeah. He always spends time, and I want to touch on that a little bit today. But one of these good memories that I have of Dr. John is there was one of the younger physicians was having a baby, and Rosemary wanted to have a shower, a celebration, so invited all the female docs over to our place to do so. So I was relegated to another room, and then I peeked out the picture window, and I saw this one lady walking up the driveway, and this lady was wearing a green dress and great big shoulders, great big shoulders and a big blonde stack of hair.
Honey?
Yeah. So I thought to myself, wow, that's an interesting looking woman. I go to the door, and it's Denby with a wig on who wants to come into the party, laughing his head off. So that's been one of the funny things that we've run across for sure. Most recently, I was talking to John about what would this podcast kind of look like, and John was asking me questions about it, and I was saying, it's just two guys having a conversation. We're going to talk about a lot of different things. And, one of the things that I wanted to talk about was, creating culture at work. And I wanted to know about what life was like after you stop being a doctor and going to work every day and going through the grind and what that's like. We'll get to some of that stuff.
Sure.
But we are we're going off for a beer, because we're going to talk about the show, and John was ready to go into the pub, and of course he saw some patients that he had dealt with for years outside of the pub, and he had to talk to them for about 10 or 15 minutes before we went in. I never thought we would get to our beer, but thank you, John, for joining us today, and welcome to the show.
Yeah, thank you very much. I'm sure glad to be here. Thanks for asking me.
Yeah. John, maybe we could start out just asking you the question about, how is it that you decided to pursue medicine, to get into it? Was that ever encouraged by your folks at home? What were some of those things that kind of put you in that framework, in that motion to do so?
I didn't have the benefit when I was a kid of getting that kind of information from osmosis, because nobody in my family had ever gone to school.
Yeah.
And so then my first exposure to medicine, I guess, was my dad got pneumonia many times, and the doctor would come to the house and he'd give him an injection of penicillin every week in his bum. And I'm about 6 years old, and I was kind of fascinated by that. And I talked to the doctor, and son of a gun, he said, "Would you like to give the injection?" So yeah, I did. I gave him my first injection when I was about 6 years old, and my dad lived through it. And I thought, hey, you might have a future there. And then time rolled on, and many things happened along the way.
Yeah.
And I could keep you going with stories, but every step of the way was fascinating.
Was there somebody that was influential to you, like at the time? Sometimes we go through these turning points in our life where somebody says, and I think that's important for young people too, is somebody says, hey, you know what? You'd be good at this. You should take a close look at this, because I think you'd be pretty good at it.
Yeah, well, that's great, and I thank you very much. I wish there had been somebody there when I was younger, but I do know that people used to kid me about two things. One, John, you're Irish. I didn't know what that meant then, but Irish was, I became knowledgeable about Irish, and I learned that I loved it. They also said, "Hey, I think you should be a doctor. You seem to like talking about animals and stuff like that." And that definitely made an imprint. And as I went along further, step by step, I got more involved with doing stuff with animals, skinning them and dissecting them, etc. And my initials were JD, just like JD Dahmer. His name is James Dahmer, I think. But and I did.
Well, that's not a good comparison, I guess.
No,
probably, yeah.
No, that's right.
Yeah.
But anyway, so I went along, and yeah, nobody pushed me, but gradually, I started to realize it. I did like people. I did like people a lot. I like laughing a lot. I like learning a lot, and I got a summer job when I was 18 in a hospital, and that.
What hospital was that at?
It was York Central Hospital in Richmond Hill, Ontario.
Okay.
Yeah. Beautiful. It was. We're from a small town, Thornhill.
Yep.
Richmond Hill's north of that, small town as well then, and oh God, I thought I died and gone to heaven that summer because I love going to work every day, and I learned so much. I met so many doctors and nurses too, which was nice, and but I learned so much that I decided I wasn't going to be a dentist. I had a weakness in my right arm that I really couldn't operate with. I realized that, so I decided to head into medicine, and the rest is history.
Yeah.
Yep.
When you tell me about the connection with Trafalgar Medical in Oakville.
Yeah.
And when you started there,
Yeah.
who was there, and what was that like? With it seemed like there was a lot of docs that were all around the same vintage, that had started at the same time.
Yeah, you're very observant, because that's true. Exactly, it's exactly. And going to Oakville, I'd never been to Oakville before, but my buddy that I had met when I was 17 and he was 18 in our first year at Gen Sci at U of T, I spent a lot of time talking to Murray, and decided that we liked each other, and he was going to be a pilot, I was going to be a dentist, but somehow during that first year, we both discovered that, hey, chemistry, medicine, that seems pretty nice. And therefore Murray and I hung out, went to school for 3 years together, lived together for 2 of them, and then after that time we had decided to become doctors. And he had heard of a place in Oakville called the Trafalgar Medical Clinic, which was started in 1961. And this is 1970. I graduated in 1971, and then started practice in the fall of 72. And Murray had already gone to work at this clinic, Trafalgar Medical Clinic.
Yeah.
And at that time he was number 4. Murray was number 5 in the clinic, and I decided to join. So in the fall of 72, I joined the Trafalgar Medical Clinic, and was now with 5 other doctors. There were 6 of us. We were probably the biggest clinic in Oakville, and I got to say it, the guys that were in that clinic were brilliant. Every one of us, including me, although you might question that, but it's true.
Yeah.
And we spent the next, me 50. Most of the guys worked 50 years at the jail, at the office, as well as working at the Milton Jail.
Yeah.
That is called Maplehurst. We worked there once a week ourselves for 50 years too.
Yeah.
Yep.
And I would imagine medicine back then was a lot different in that were you always on? Like, were you delivering babies? Were you running back and forth to the hospital? Were you seeing your own, come back and do your clinical?
Absolutely.
Yeah. So what was that like?
It was like being a fart in a windstorm, frankly.
Yeah.
Because we were always on call for each of us, for ourselves, but also for our partners too. So if a guy's away, one of us is going to cover for him delivering his baby or assisting at a surgery or seeing his patients in the office. And that was just part of life.
Yeah.
But we were kids. We were only in our 20s, and we could do it. I wouldn't want to do it now, but we could do it then.
Yeah.
And medicine for us, I always said, was like a loaf of bread. And I'm not sure how many slices of bread there are in a loaf, but average 20 maybe. Well, the jobs that doctors did, GPs did then, maybe were 20 jobs. Now, as years went by, doctors, family doctors, became less and less of significance in practice. And the jobs that they were responsible for became fewer and fewer as time went by and as specialization came in. And all of a sudden there was an orthopedic surgeon who would take care of fractures, etc. GPs couldn't do it or wouldn't do it, blah, blah, blah.
Yeah.
And that was the same case in every field of medicine. Sadly, when I retired 8 years ago from my practice, I would say that, I bet you that there were really only 3 slices of bread in that loaf.
Yeah.
And that would be office practice, and at the end, no hospital practice, no obstetrics, no surgical assists, no house calls. Didn't do house calls.
Yeah.
Didn't work in the hospital. Anyway, we were limited then, and now as time has gone on, medical practice has become more, in quotation marks, simplified.
Yeah.
It's simplified. Yeah.
Do you think, John, that some of the things that's been driving that bus has been, like, even for family doctors, I think it's unusual now, correct me if I'm wrong, even unusual for docs to do a lot of obstetrics. So is the liability of that and the malpractice insurance and everything like that, is that kind of driving, family doctors just don't do a lot of it because of the costs or possible liabilities involved?
Well, if you're talking about south of the border, the cost of malpractice insurance is really high.
Yeah.
And that would deter a lot of people from going into the practice.
Yeah.
In Canada, our dues, the fees that we pay to our medical association and for medical insurance, they're covered to a big part by the government of Ontario.
Yeah.
So therefore, our numbers haven't changed a whole lot over the years. So that would not be a big deterrent. Now, if we followed the same lead that the American medical doctors have followed, that cost of insurance would become more significant, and it would deter a lot of guys from staying in the practice.
Yeah.
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 Before you guys continue, I know you're on a good roll. Dr. John, do you just want to pull the microphone a little bit closer to the edge?
Oh, yeah.
Just a little bit. Yeah, that's perfect.
Is that better?
Thank you.
Okay. Do I look into that? No, I'm kidding.
I'm going to ask you, John, about let's say there's a student that comes to you or some family friend, and they're a smart kid and they're doing well in school, and they're saying, yeah, I'm thinking about getting into medicine. Would you give some advice? Like, would you say, yeah, family medicine's a good way to go, or give some thought to maybe a different discipline? Mm-hmm. I'll ask you that question.
Yeah. Wow.
Yeah.
And like that really is a tough question to answer.
I'll start right from the beginning
okay,
again.
Sure.
Okay.
Go ahead.
John, if let's say there's a family friend, or maybe it's somebody in your own family or a neighbor, or somebody comes to you and they're doing really well in school, and they're considering going into medicine, and they said to you, Dr. John, like what should I really be thinking about? What discipline should I get into? What would you advise? What kind of advice would you give to them?
I love that question.
Yeah.
That's an excellent question. And
once in a while, I'll ask good questions.
well, it's because you're so good looking, and your wife is pretty, and I've had a crush
Stop
on
it.
her for.
Stop it.
Anyway, I love it. I love telling you that.
Oh,
and
I
telling
know.
her that too.
Yeah.
Yeah. So, I would be. I loved general practice. I could have been a surgeon. I could have if I wanted to be, but a GP I knew knew a lot of stuff. And I heard the story the years ago that a good GP knew, he knew a lot about, oh geez, how did I word that? Not much of anything. He knew a lot about everything, but not much about anything.
Okay.
A lot about everything, but not much about anything. And
Okay.
that statement would imply that, if you're a specialist, you're going to know more. Well, I differ with that because GPs know a heck of a lot, but from a different point of view than a person practicing general surgery, neurosurgery, internal medicine, cardiology, respirology, whatever specialty. The GP knows a significant amount. It depends on his age and his interest level.
Yeah.
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 And I was always interested.
Yeah.
Yeah.
Yeah. Yeah.
I loved it.
Yeah.
Yeah.
I'm going to switch gears on you a little bit.
Sure.
I want you to talk to us about. Tell me about values, and I want you to think about when you were working in the clinic, and you would, and I heard you. I could hear you, and I could hear you interacting with people, and you've got a gift, or you have a gift for doing that, but you make people feel good. And I'm sure that even if you had to deliver bad news, that you probably did it in a way that was really helpful for the patient at the time.
I hope so.
Yeah. So
Yeah.
talk to me about, like, where does that come from? Does that come from your folks? Does that come from the way you were raised?
Sure.
Does that come from, being part of a church community? Like your friendships? Where does that come from?
Well, yes to everything you've said there.
Yeah.
So, I grew up in Thornhill. Mom and Dad were farmers, had been farmers, and we had to leave the farm when I was 2. We moved to the Thornhill and lived in my grandparents' house. Now, that made a huge difference in everything that happened in my life after that, because I was living on a street in Thornhill that was inhabited mainly by a bunch of senior citizens who were my grandparents' age and not my parents' age.
Okay.
And therefore, I knew a lot of these older people. And that paid off because I used to get summer jobs working with them in their yard, their garden, the whole works.
Yeah.
That paid off. But I also, dealing with them, I learned a whole lot about dealing with old people. And I loved it. I found that I loved it. And I could extrapolate that knowledge and that ability and that comfort and that fun-loving spirit for young people and even down to kids. So by the end of the time, I had done my 3 summers in the operating room, and I had worked in hospitals in medical school. By the time I got to practice, I had been prepared a lot along the way, and I knew that I was going to love medical practice. Our GP in Thornhill, good guy, and I liked him. Everybody loved him.
Yeah.
And he's the guy that let me give my dad the first injection of something into his bum.
Yeah.
And that always left a remarkable feeling in my brain.
Yeah. What's been the hardest part for you about retiring? Because it does seem like it's also a grind, like all those good things that your career brought for you, but it also does seem like a grind. What's been the toughest part?
Yeah, that is really a good question. You're asking good questions.
Well,
you're a pretty fart smeller. So, yeah. So, the hardest thing, well, it's a matter of how you apply yourself to the course that you're on from the first day you practice medicine till the day you retire. And I learned back in my first month, I bet, from a journal, and it said that the first day you work is the first day you should start planning for retirement.
Yeah.
I never forgot that. That stuck in my mind, and it stayed so significant. So all my life, I have planned and tried to develop interests and hobbies and friends and activities so that I'm padding the bed. I'm trying to up my chances of having enough stuff to do in retirement to keep me happy.
yep.
So I went through life, and I got married, and I had 4 kids, and now we have, since I retired, when we had no grandchildren, now 8 years later we have 9 grandchildren.
Awesome.
So
Congrats.
we've grown. And during that time, of course, I still love medicine. I love my family. I love life. But when it came down time to retire, even though I had done all this stuff in my life thinking, oh, you're prepared for retirement, when retirement hit, holy jeez, I don't have anything to do.
Yeah.
I don't have anything to do during the day, which will cost me 12 hours.
Is it that sort of feeling of purpose? Because
Oh,
you know,
yeah.
prior to that, lots of purpose, right?
yeah, sure.
Yeah. So feeling like I've got to somehow, some way reinvigorate that purpose.
Well-
and I don't think that's unique, John, to just
Yeah.
medicine. I think it's people in general that
For sure,
retire.
for sure, yeah.
Yeah.
I'm sure everybody, doesn't matter what their job is, they've been programmed. And I, in my medical practice, I loved psychology, psychiatry, and neurology. They're the areas that I was most interested in and most enjoyed, I bet. So I've learned an awful lot about habits. When people get habitually trained to do a certain thing, which used to be called brainwashed. Okay? So all my life I was brainwashed that I'm going to have to work and work and work. Later on, I realized, after I got close to computers, I realized that term could be, should be, would be replaced by, and it was, by programming. So my brain has been programmed.
Yeah.
The circuitry in my brain involving, if you can believe this is the part that really astounds me, and I've only known this for the last 5 years. Each human's brain contains, wait for this, 5 trillion neurons, each one of which has between 6 and 10, what are they called? Synapses, okay?
Yeah.
Which connect those cells to all the other cells in your brain, which means
Unbelievable.
in the trillions. So very, very, very complicated, very difficult. But when those cells have gotten together for 50 years to fill a day in a certain way, I've learned since I retired that it's not that easy to decompose, to decompress,
Yeah.
to de-learn that.
Yeah.
So therefore, I found myself at first thinking, what the heck am I going to do?
Yeah.
You know, I've got 12 hours a day that I filled with seeing patients. And now I've got, well, the other 12 hours have to give rise to family time and sleeping time.
Yeah.
Well, there wasn't a whole lot of time to do anything else. Maybe I was bored. Maybe I was just unhappy, but I didn't like it very much, and I couldn't believe it.
Yeah.
I
Yeah.
couldn't believe that I was feeling like that. It took several years to get over that and to realize that, yeah, sure, all you got to do is start building again.
Maybe this segues into the next. I think you touched on it a little bit about, let's say this is back to an advice question, and maybe it's for the medical student, but maybe it's somebody just generally starting their career out.
Sure.
And Dr. John is going to give some advice to somebody that's starting their career about either good physical practice or good mental health practice. These are kind of some of the things that you need to keep in mind when you're starting out in your career. Would you say there's some of these things come to mind right away?
You mean practices on my part?
Yeah, no, I think just so that this young person could keep in mind, here's some of the things I want to remember to be physically healthy, but also I want to be mentally healthy too.
Oh, yeah.
So what are the things that I'm going to have to incorporate in my life that's going to lead to those outcomes?
In that
their
young
life.
fella's life.
In their life, yeah.
Okay. All right. You know what? I'll say it again then. That goes for any young person, and it goes for any field. It is. So, in my case, I learned from a very respected surgeon in Oakville when I first started. He said, "John, I want to tell you the 3 most important characteristics in a person that guarantees a successful career in medicine. I'd never heard of such things as that, but I was spellbound, waiting to hear what he
Yeah.
said. And he said there are the 3 A's. Well, I like that. I like things organized like that. And he said, number 1, ability. Number 2, affability. No, number 2 was availability. Number 3 was affability.
Yeah.
Now, at that stage in my life, I wasn't quite sure about affability, and the other ones I knew, but not as well.
Yep.
And so anyway, so I learned that day those 3 things, and I had to concentrate on getting those 3 things going. You got to be able to get along with people. You got to be there for them, and you've got to know stuff. And you've got to be interested. That means you've got to be open to new stuff, to learn stuff as you go.
Yeah.
So when you're working in a new job, you have to be able to look at what your job entails and find out what it is that you're interested in that. And you have to make yourself, and I believe that's the word, make yourself interested in that topic and become as interested as you can, and thereby learn so much about it. Ask a lot of questions, which initiates conversation with that person you're talking to, and keep the channels open.
Yeah.
And show interest, show enthusiasm, ask questions.
That's why I like talking to you, John, because you know what I'm thinking about right now? I'm thinking about, you remember that show Columbo?
Oh, yeah.
You remember Columbo?
Oh, yeah, right, I do.
Right?
I do. Yeah.
And Columbo would always have this curiosity. He might have even known the answer already. But, like, help me understand, tell me a little bit more about that.
I know.
And then before you know it, he'd catch the bad guy, right?
And it was always the same. Just before he left the room, before he left the camera, he'd say, "Oh, I have another question," and boom, you know that hiatus in the conversation was going to be filled with a whole bunch of success.
Those old shows were great, eh?
They were.
Yeah, they were fantastic. And I was a little kid and I'm watching these things, so I probably didn't get half of the innuendos or anything like that, but I really enjoyed them.
Yeah.
John, thanks so much today for joining me and doing this. And I think, people that are, get a chance to check this out, are going to look at your life and try to emulate some of the things that you've done in your life. And I really appreciate you coming today.
Oh, wonderful. It's wonderful. You know something? You see, what you just said was so satisfying to me. That makes me very proud of you for thinking of those questions, but of myself for having worked on myself all my life, making John Denby the best John Denby he can be. And so far, so good.
Can I give you a word of advice?
Yeah, sure.
Stay away from my wife.
But I still have a crush on her.
Thanks, John.
Thanks a lot. That's
Okay.
great.
Okay.
Kevin is wonderful. Oh, what a ball. This is great.
Yeah.
I love it.